Could one test save your life? For millions, routine health screenings are the difference between early treatment and crisis. Today we'll walk through essential screenings everyone should know, why they matter, what the science says, and how to take simple next steps. This is for anyone who wants to stay healthy, catch issues early, and live with confidence. We begin with a relatable problem. Many people assume they feel fine, so they skip checkups. But feeling fine doesn't always mean everything is okay. Silent conditions like high blood pressure, elevated cholesterol, and early-stage cancers can show no symptoms until they're advanced. That's why regular screening is powerful. It catches problems when they're easiest to treat. Let's start with cardiovascular health. High blood pressure, or hypertension, is called the silent killer for a reason. It rarely causes symptoms, but dramatically raises the risk of heart attack and stroke. The simple science, elevated pressure, strains arteries and organs over time. A blood pressure reading is quick, painless, and available at most clinics or even pharmacies. Adults should check at least once every 1 to 2 years, more often if readings are high or you have risk factors like family history, smoking, or diabetes. Next, cholesterol testing. High LDL cholesterol contributes to plaque buildup inside arteries. A fasting lipid panel tells you total cholesterol, LDL, HDL, and triglycerides. The science, lowering LDL, reduces the risk of heart disease. Lifestyle changes like diet and exercise can help, and medications are available when needed. Talk with your clinician about how often to test, generally every 4 to 6 years for low-risk adults, more frequently for those with risk factors. Blood sugar and diabetes screening are essential too. Prediabetes can be reversed with lifestyle changes, but left unchecked, it often progresses to type 2 diabetes. A simple A1C blood test shows average blood sugar over 3 months. Screening is recommended for adults starting at age 35, earlier for those with higher risk or family history. Early detection allows for diet, movement, and sometimes medication to prevent complications. Cancer screenings save lives when done at recommended intervals. For people with a cervix, cervical cancer screening through Pap tests and HPV testing detects precancerous changes. Guidelines vary by age, but generally start in early adulthood and become less frequent with consistent negative results. For those with breasts, mammograms can catch breast cancer before it is felt. Screening typically starts around age 40 to 50, depending on risk, and earlier for those with a strong family history. For colorectal cancer, screening options include stool-based tests and colonoscopy. Colonoscopies can both detect and remove precancerous polyps. Starting ages often range from 45, earlier if you have family history or certain symptoms. Lung cancer screening is recommended for people with a significant smoking history. Low-dose CT scans can detect lung cancers earlier than X-rays. Because lung cancer outcomes are much better with early detection, eligible individuals should discuss screening with their provider. Bone health matters, especially with age. Osteoporosis increases fracture risk and quietly reduces bone density over years. A DEXA scan measures bone density and identifies those at risk. Postmenopausal women and older adults often benefit from screening to guide prevention like calcium, vitamin D, and weight-bearing exercise. Sexual health screenings, including tests for HIV and common STIs, are important for anyone sexually active. Early diagnosis allows prompt treatment and reduces transmission. Testing intervals depend on behavior and partner status, but getting tested at least annually or with new partners is a strong practice. Mental health screening is often overlooked but vital. Short, validated questionnaires for depression and anxiety help catch issues early. Mental health affects physical health and daily functioning, and screening leads to timely support, therapy, or medication when needed. Ask your clinician about routine mental health checks, especially during major life changes. Vision and hearing screenings maintain quality of life. Gradual changes can go unnoticed. Regular eye exams detect vision problems, glaucoma, and even signs of other systemic diseases like diabetes. Hearing checks are important as untreated hearing loss can affect communication, mood, and cognitive health. Immunizations and preventive visits complement screenings. Staying up to date with vaccines like flu, shingles, tetanus, and COVID-19 protects you and your community. Annual wellness visits provide a chance to review screenings, medications, and lifestyle goals with your clinician. Now, how to act on this information. First, know your personal risk factors. Age, family history, lifestyle, and existing conditions. Keep a simple health journal or digital record with dates and results of screenings. Second, talk with a trusted clinician to create a personalized screening plan. Guidelines are general. Your plan should reflect your individual risks and preferences. Third, focus on prevention, balanced nutrition, regular movement, stress management, sleep, and avoiding tobacco. These choices lower risk across many conditions. Practical tips to make screenings easier. Combine appointments, ask about tests that can be done at home, and check community clinics for low-cost options. Many workplaces and pharmacies offer screening events. Bring a list of medications and family history to appointments to save time. Advocate for yourself. If you're concerned about a symptom, ask for the appropriate test even if routine schedules differ. Address common fears, fear of results, discomfort, or costs. Most screenings are quick and safe. Early detection often means simpler treatment. If cost is a concern, explore community resources, sliding scale clinics, and insurance coverage. Emotional support matters too. Bring a friend to appointments or use telehealth when available. Remember that screenings are one part of a broader approach. Healthy habits, regular checkups, and open communication with clinicians work together to protect your well-being. Track your numbers, celebrate small wins, and adjust your plan as life changes. In closing, routine screenings are an act of self-care and prevention. They give you knowledge and the chance to act early. If you take one thing from this video, know your risks, get screened, and take control of your health with calm confidence. Share this information with someone you care about and schedule your next screening today. Could one test save your life? It might, so don't wait.